University of Benin Teaching Hospital. I have with me in the studio Dr. Iozo Stanley, immediate past PRO, Edo State Nigerian Dental Association, Senior Registrar, Department of Oral and Maxillofacial Surgery, UBTH. Good morning, sir, and welcome.
Thank you very much.
We also have Dr. Anago Buchi, Secretary General, Medical Women Association of Nigeria, Edo State Chapter, UBTH, Senior Registrar, Pediatric Dentistry, UBTH. Very good to see you again this morning.
Good morning.
And we also have Dr. Udobi Loki, Assistant Secretary General, Edo State Nigerian Dental Association, Senior Registrar, Department of Restorative Dentistry, UBTH. Good morning, sir. Welcome.
Good morning. My pleasure.
All right, let's start with Dr. Udobi. Tell us exactly what oral health is all about.
Thank you very much. Oral health is a state of absence of oral disease, a state of healthiness of the oral tissues. When I say the oral tissues, I mean both the hard and the soft tissues of the oral cavity, the tongue, the teeth, and all the structures in the mouth. That is essentially what oral health is all about, yeah.
But do you think enough awareness has been given about oral health?
Well, we don't think so, which is why, as part of World Oral Health Day activity, we try to create awareness about oral health and the need to take care of the oral health.
Okay, now coming to Dr. Iozo, and I'd like you to address this once and for all, because some individuals, they just brush their mouth probably just in the morning, and then they eat morning, afternoon, evening, and then the next day they brush their mouth in the morning, and they feel like they're doing enough when it comes to caring for their mouth. Is this valid?
Thank you very much. Yes, it's valid, though not complete in essence, because when we look at caring for the oral health, we, as part of education, we try to incorporate, we will try to look at 4 factors which have been implicated in as a cause for oral health diseases, particularly dental caries, which is, I think, is a common oral health problem. We want to look at time, want to look at the microorganisms, which obviously are present in the mouth, want to look at the tooth substance, and then want to look at plaque, which is debris, things that are caused by food. Now, anytime we try to maintain a good oral health, we are trying to disrupt this balance, because we need all these factors in play for there to be progression of an oral health disease. Now, brushing the teeth, as you said, is a part, because that will help get rid of those deposits which are present in the teeth. Like I said, part of the factors, we are looking at plaque. Then regular daily brushing, morning and evening, helps to shorten the time. As well, the toothpaste, which is the agent used to brush, helps. It has some antibacterial properties, so it helps to eliminate those bacteria that have been associated with causing that the tooth disease. Now, this is good, but in addition to this, we usually inculcate a lifestyle modification, which has to do with your diet. We know that sugar, especially the high sugar diets like sweet chocolates, have been implicated. So you want to inculcate the habit of taking things that have more fibers, which will help control this. And then a lot of other things as habits of using things to file in between the teeth, using your teeth to bite nails and all that. All these are added to the regular daily brushing for maintenance of oral health.
Okay, so you're basically saying that if an individual brushes his or her mouth once a day,
Yes.
but doesn't go about biting teeth, fingers like you said, or taking sugar and all of that, the person's on the right path.
Well, we consume sugar. I'm not saying, we are not trying to discourage people from consuming it. But in addition to that, having it moderate, as in moderation, you inculcate some habits of, in addition to it, like consuming fruits, things that have more of high fibers, and always routine, having a habit of having a checkup with the dentist, because most of these dental diseases happen insidiously. Most times people present at our clinics when they're already having pain, and by the time you're already having pain associated with the tooth, it has really progressed far into the pulp of that tooth. So most times at the checkups, the dentist is able to locate those teeth that require filling, and also able to maintain the oral health by way of there's what we call oral health prophylaxis, which includes scaling and polishing, which is recommended at least twice yearly, once in 6 months for every individual. So all these are added to the social modification, all right, in addition to the routine of brushing morning and evening daily.
Okay, thank you very much. Now, coming to Dr. Buchi now, there are some practices that people might engage in that is bad for their mouth, and they are probably unaware of it. So what are some of those things that people do that are bad for their mouth, but they don't know about it?
Okay, thank you so much. First of all, part of it is that you're brushing once daily. That's not very good. You're supposed to brush twice daily. That's after your meals in the morning and after your meals at night. Then 2, many of us try to open our drinks with our teeth. That can crack your teeth and you start having sensitive teeth. Also, we also have sometimes when people use toothpicks, we actually discourage the use of toothpicks in removing food particles in between our teeth. We advocate for the use of dental flosses to clean in between our teeth. And also, when people don't visit the dentist, that's a bad habit. You're supposed to visit the dentist every 6 months, whether you have pain or you don't have pain. You're supposed to visit so that we can actually help you and guide you through your oral health. That's like a summary.
Okay, recently I was reading up about ultrasonic plaque cleaners, and then I was on the fence because I wasn't really sure if it was good because it's a homemade tool. It's a tool you can use in homes to clean plaque and tartar from your teeth. Is it healthy to make use of this ultrasonic plaque cleaners to clean the mouth?
Okay, well, thank you very much for that question. Yes, it is healthy when used professionally and when used by professionals. All right, we try as much as possible to discourage the use of those ultrasonic scalers by yourself at home, because apart from cleaning, it can cause some form of injury. But when used by professionals in the hospital, it is safe, because it is actually controlled. You can see exactly where you're working on. So
you wouldn't say or advise persons to use this at home on their own?
By themselves, no. Non-professionals shouldn't.
Okay, but how about teeth whitening? I've seen a lot of experiments on social media. Chemicals used on the teeth. So what's the right way to go about teeth whitening process?
Okay, let me come in here. I know teeth whitening, everyone wants to look real good. They want to have their teeth as white as possible. But in as much as it's a good thing, it also comes with its pros and cons. Looking at teeth whitening, we have basically 2 forms. There's that which is applied by individuals at home, and there's the one that is applied professionally. Now, there are a lot of manufacturers of teeth whitening agents, and they can whiten the teeth up to a certain state. Now, we want to advise the public when it comes to teeth whitening to first of all consult a dentist. The dentist can recommend either the home or professionally applied, depending on his assessment of the level of discoloration of the patient. Why I want to stress this is, in as much as there are various products in the market, most of them have not passed through the scrutiny of bodies to regulate its usage and as well as constituents. Some of them come up with side effects like hypersensitivity or even rebound discoloration with their use. So I want to stress this point, especially when it comes to teeth whitening. Thank you.
All right. Clearly, there are some kinds of oral diseases, and that's one thing that the oral health they set to educate people on. So, what are those oral diseases? And are there? Just tell us about oral diseases.
Okay, there are a number of oral diseases that affect that commonly affects both children and adults. The most common ones being dental caries. Part of the symptoms of that is the most common symptom of that is actually pain. A lot of people complain of pain or they complain of a hole in their teeth. There's also bleeding gums, what we call gingivitis. That is also quite common, especially when people don't clean their teeth or also when they don't visit the dentist regularly. There are also other forms of oral diseases like malocclusion, when people have teeth that are not well arranged and yet they are set to go for one beauty contest or another. They can't even smile in pictures and all that. And there's so many other diseases like when you have your teeth shaking, what we call periodontitis. You have bad breath, what we call halitosis. And then also there are also other things that can also affect the other parts of the body, like a child that is born with cleft lip and palate. Is the oral maxillofacial surgeons that actually help in the closure of these conditions. So there are lots of things that affect.
Are there complications? Are there complications that can result from these oral diseases?
Yes, there are complications that can result if left unmanaged. Some of which are tooth loss, bleeding, the pain could even progress even more. So in addition to it, we also have cancers. These are oral conditions. If left uncontrolled, it could spread further into other areas of the body. And ultimately, they could result in death.
Tooth.
Yes.
Oral diseases.
This is a point we want to stress because so many are sort of negligent of when it comes to oral conditions or oral diseases, because so many people come up with thoughts like, how can someone really die from just a tooth? And we've seen a number of them. They're actually sequelae of dental conditions. It can just start from just tooth decay down to caries. Once it's within the pulp, it creates an infection. It gets into the bone supporting these teeth, spreads there, causes an abscess, which is a collection of pus. It begins to spread into facial spaces, which are spaces around the neck. It could result into a Ludwig, could compress the airway, and from there, we have other things like death arising from maybe asphyxia. If it's a cancer, it could become it metastasized. What I mean is that it spreads into other areas like the chest and all that.
And then for children, toothache can make them miss school, can make them not do well in school. And some of them too might become timid and shy to smile in pictures if their teeth are not well arranged. So those are part of the complications that could arise from oral diseases affecting children.
And now you mentioned children. Okay, go ahead.
Even a simple psychogenic halitosis can make people have suicidal tendency. These are all the deaths we talk about from oral conditions.
Well, now that you mentioned children, I'd like to know how early is it what is the appropriate age for kids or children to start visiting their dentists?
as soon as they start developing their first teeth, the parents should ensure that they have a dental visit.
We say by their first birthday.
Okay, by the first birthday.
That's when you should visit the dentist. While you're preparing for your child's first birthday, also schedule a visit with the dentist. But brushing begins as soon as the child develops even one tooth in the mouth. That's when you should introduce your child to a toothbrush and a toothpaste.
Oh, that's really educated.
And that's as early as 6 months.
As early as 6 months, introduce your child to toothpaste. What kind of toothpaste?
Fluoridated toothpaste. A toothpaste that must contain fluoride, because fluoride is very important in strengthening the tooth.
What kind of toothbrush?
Well, there are different types. But for children, we recommend soft bristle toothbrush. And then for younger children, like for children that are like babies, there are finger brushes that can be used too.
Okay, finger brushes like that. Okay. All right. Let's talk about the theme of this year's event. It's on from 2021. Correct me if I'm wrong. Be proud of your mouth. It's up to 2023. How much awareness has been done in this light?
Well, for this year, from 2021, we have been trying to create awareness. In 2021, we did outreach within Edo State. I can speak now because the events occur simultaneously all over the world, but within Edo State and in Benin City, we try to have programs in various locations to sensitize people about their oral health. And then last year we went to the major markets within Benin City, and we were able to talk to market women, talk to even buyers. Then this year we went to the internally displaced persons camp, that's IDP camp, to talk to them about oral health. We even added some forms of intervention in the camp because of their peculiarities and because of the level of burden we saw there. So we're trying to do our best, but we still think that there's room for greater collaboration. There's the need for us to also reach further, maybe those in the villages that we may not be able to get across to, which is why we try to partner with TV stations, radio stations, so that people can also get to know about what we are doing.
So is it okay?
Then, in addition to, I think, sorry to delve into this part, but it's still a part of oral health awareness. There is something that is so common that we find daily among individuals as the reason why they lose their teeth. And we find out that they all come with a story that they are worms. They're actually worms. And these worms walk around from one tooth to another. And anytime they have a tooth extracted, that the worms leave that already extracted tooth into another sound tooth, and it spreads like that. We hear this a lot, so common. And I think I want to stress this point here to correct our audience. Now, when we talked about regular dental check, which is the routine checks, where if there are teeth decays, which are carious teeth, they are immediately noted and filled. It prevents or it stops a progression. It starts from a hole as small as it can be, progressively increasing in size. At this point, these individuals feels no pain. But at the point where it breaches this barrier covering the pulp within the tooth, and then there's an infection, there may now be pain. Now, it's not as if this is peculiar to only that tooth within the mouth. It may be occurring in several other teeth within the mouth at different stages. It's just like a number of athletes about to take a race. After the sound of the gun, they begin the race. Now, it has to be one person or two that cross the finish line first. It's not as if there are not others about to cross that finish line. Now, what I'm stressing is this. Most times people present to a dentist and say, or maybe a traditional practitioner, and say, oh, this is the tooth hurting me, get it out. The person takes this tooth out without addressing other teeth, which are still on this race, progressively coming to that finish line. So most times when they have just a single tooth extracted without taking care of the others, maybe in 3 months, another one crossed the finish line. They say, oh, it is the one from the one which they have extracted that moved to the one which they have currently. It has become a belief model that people have been transmitting to people, and we hear it daily. In fact, I had the most recent one just 4 days ago. A patient told me. So I want to use this medium to debunk this from their thought. There's no such thing as worm spreading from a tooth to tooth just because maybe you've had an extraction of a particular tooth. It's probably because there was not a general review of the whole teeth in the mouth. Now, whenever you have a single tooth with a particular condition that has crossed the line, it's already symptomatic and is treated without addressing other teeth, which are also progressive, because this condition, when we treat patients, we deal with them holistically. All right, so whenever there's a single tooth progressing that far, it's probably a sign that there are several other teeth within that same mouth that are close to that point. So when these are also addressed, it stops any subsequent manifestations.
Okay.
Yes.
Okay. Also, in addition to having oral health campaigns in markets and in the IDP camp, the Medical Women's Association of Nigeria, in collaboration with Nigerian Dental Association, also went to schools to talk to them about their oral health. We had we visited about 17 schools this year, and
in Benin City.
Yes, in Benin City, and it was a very, very nice activity.
Very good to hear that. Very good about the topic of some kind of misconceptions, and I'd like you to address a whole lot of that. One of them is the fact that a misconception that says tooth loss is genetic, and also as it relates to the harder you brush your teeth, the cleaner it will be. So I'd like you to address all these are more misconceptions, especially if you have a pain in your mouth and you put salt in water and then you keep it in that particular place in your mouth, the pain will subside. There are lots of misconceptions. I would like you to address them.
Okay, yeah. Yes, those are additional misconceptions that are totally untrue. Primarily, we expect whenever an individual has an issue with a tooth, consult a dentist. I'm sure that's where all these other theories or things sprout from. And we find out that most individuals take them so seriously. Well, brushing the teeth forcefully is incorrect. There is actually a technique for brushing the teeth. I cannot describe it now, but when you see a dentist, he will show you how to do that just the way it should be. You could brush your teeth so forcefully in the wrong way, and you, instead of cleaning your teeth, you would have probably killed a fly which is just settling on a glass table. So you crack the table, you killed the fly, but you broke the table. So in as much as you want to get your mouth clean by brushing it, you want to only handle those debris that are settled on it and not to destroy the sound tooth structure. So there are techniques of doing that. But when you see a dentist, all these are corrected.
All right, sir.
Okay. Well, on the case of brushing, the reason why we recommend that you brush immediately after eating, your last meal at night, and after eating in the morning is that by then your deposits are still very soft. They just got attached to your teeth, and you don't actually need force to get them out. You just do a gentle sweep with your medium bristle toothbrush.
No, that's the recommended, not the hard brush.
No, not the hard brush. We don't recommend a hard brush. It's the medium bristle toothbrush. So you just do your gentle sweep and it gets it out. You don't need to use force, because using force can cause harm to both your teeth and your gum. And then you will not have to battle with the consequences of that, and then you now have to start managing your other conditions that you have caused yourself. So we recommend medium bristle toothbrush, fluoride containing toothpaste, non-herbal. Then we recommend that your brushing should be...
You said non-herbal toothpaste?
Yes please. Non-herbal, fluoride containing toothpaste.
And then for children, we recommend that you use soft bristle toothbrush and your fluoridated toothpaste.
Okay. Just before we wrap this up, I'd like you to address this. And there's a popular saying, that I've heard over time, that the teeth doesn't die a natural death. We kill the teeth. How do we kill our teeth? You mentioned brushing, it's quite important. And sugary foods, it's quite important. Well, is there any other way that we kill our teeth? Is the saying?
Well, there are still other ways. Some of them fall in wrong habits of using the teeth to perform some activities as opening bottles. And there are people who actually file their teeth. Most times, some ladies want to look aesthetically pleasing, and they feel when they have a gap tooth in front, they are more appealing. And so, some visits, some traditional practice. I won't say a dentist, because a dentist won't do that. What you do, whenever you do that, you destroy sound tissue, and it's usually not advised. So most times, we damage our sound tooth structure through those means. Sorry, lastly, I also want to, sorry to interject, I think we should have mentioned this earlier. We want to also thank the Edo State government for creating a Department of Dental Service in the Ministry of Health. The implication of this is that it will complement our efforts in sensitizing the public.
Yes.
Oral health policies can also be implemented at the state levels as it trickles from the Federal Ministry of Health downwards. Thank you very much.
All right, so is there any event in Benin today to mark World Oral Health Day was on Monday, but are there any events today? Any programs?
No.
Okay.
I think this is part of an event, though. And after this, there's
Spelling bee.
Yeah, want to be part of the spelling bee.
Yes.
All right. Okay. Thank you very much, Dr. Iyozo Stanley, Dr. Anago Buchi, and Dr. Udobi Loki for gracing us with your presence this morning on the program. We really do appreciate it. Like they mentioned, join us at 11 o'clock for the Kiddies Ultimate Challenge. We'll be talking dental questions and answers and all of that, to join us. In the meantime, I gotta go now, right now. Good morning, I'm Gloria Vitalis.